questions for you guys. We're going to start with, a lot of people ask, does it hurt? With fillers and Botox.
So Botox is a little teeny tiny insulin syringe, so it's really small. Even if you're needle phobic, it's not bad at all. I do have patients that sometimes ice before, just to superficially numb, and they do great with it. So I wouldn't say it hurts.
No, it's not really bad.
Filler, it just depends on where it's placed. Some of our fillers actually have numbing in them, which is nice. Lips are tender, so you think of any time you've bit your lip or gotten your lip smacked or whatever, it's a little tender. I'd say like cheek and other filler, not necessarily tender to do it, but you're a little tender the day or two after.
Yeah, it's a swelling afterwards too. Yeah. It's kind of a little tender, especially cheeks.
You go to wash your face and you're like, ooh,
You can feel that.
Yeah, you definitely get swelling. It's a swelling. And
do you suggest anybody takes like ibuprofen if they're
so
if they don't have a high pain tolerance?
They can cause a little bit of bleeding, so they shy away from that.
Wait until after. But like we can do ice to kind of superficially numb. If we're doing a cannula with the lips, then or any lips in general, we do topical numbing, or we can inject numbing. They can even do a nerve block like the dentist does, so they'll have the same numbness like that. So we have things that can help. We also have that one thing now. We have like happy gas that we're gonna be able to introduce.
Cool. Do you feel like though most people are after they have it done, they're like, oh, it's the anticipation.
All the time.
Yeah. Because I think that seems to be the case most of the time after they
themselves up and go, oh my gosh, this hurts so bad.
And you can kind of get through anything, if it's something you really want. You're like, okay, I can endure 10 minutes of pain. Yeah. But like cheeks, like a lot of people are surprised. They're like, oh, that's really not that bad. Yeah.
Awesome. Okay. Another question we have asked all the time is, what about swelling after you do Botox and probably more specifically filler?
Botox, not necessarily. I mean, it looks like you have little mosquito bites for about 20 minutes.
Red marks sometimes, but some people don't have them at all.
Yeah,
it just depends on the skin.
And swelling is completely independent too. So like I'm a sweller. I know for a fact it doesn't matter how I get injected, I'm going to swell for at least 2 to 3 days afterwards. So ice packs, arnica, ibuprofen, even sometimes like Zyrtec can help with an antihistamine response.
Yeah.
It's everyone's different. I like to anticipate for the worst and hopefully expect the best.
Totally. And some areas swell more than others. Lips definitely are going to swell.
Enough where people don't want to go to work or what, like, how do you
everyone's
handle
different.
That?
The last time I got my cheeks done, I went to dinner with my husband and in-laws, and I guarantee none of them knew.
And most people
because my husband picks up on it pretty quick. So
most people don't. But some people, if they're worried about bruising, or if you're worried about any type of swelling, maybe do it on a weekend. Have the weekend to recuperate, and then on Monday, you're back to work.
Say kind of the morning after is the worst usually. Even if you get your lips done at 8 a.m., you go about your day. Gravity helps a little bit. You lay down flat at night, so any of that trauma and swelling kind of accumulates. So you wake up the next morning and you're like, woo! That's usually the worst. And then gravity again takes hold. So I tell people, wake up 20 minutes early for work, ice for 20 minutes, take some ibuprofen, take some Zyrtec, let it kick in, and then
what's nice too is with lips, if people are scared about lips, because those are usually the ones that people are scared about. Doing a half a syringe versus a full syringe. Just do baby steps to get there. And you don't swell as much with a half a syringe. I mean, you swell a little bit, but then you build on top of each other. So that's another way to do it too.
Yeah. Everyone's different though.
Yeah. So how long does it last?
So Botox normally is about 3 months. Any of your neurotoxins, Xeomin, Dysport, usually around 3 months.
Yeah.
The more you can keep that muscle kind of weakened, sometimes you can push it out longer. Some people are like, gosh, I retained it for like 4 months. Well, kudos to you, because you're like,
and some people's muscles are a little stronger than others too. They eat up a little bit more, but 3.5 months is typical. Filler,
it ranges depending on what kind of filler you're using. So we do have a 5-year filler. Obviously, it can't be put in lips. It has to be put in bulkier places. Radiesse is a calcium. It's usually year and a half. Yeah. And then hyaluronic acid, anywhere from like 6 months to a year, depending on which one you use.
And where you put it. Tear troughs will last a little longer because you don't move that area. Lips get broken down more because you talk with your lips. And so those things get broken down a little bit faster, and it depends on if you want to grow your lips or, Yeah. Depends on
And it
that.
depends on metabolism too.
Yep.
So if you have a quick metabolism, you can kind of eat through product a little faster.
Yeah. So with that, I know there's a lot of questions about like Botox. Maybe explain the difference between Botox and Dysport, and because I think people sometimes don't realize.
So they're all made by different manufacturers.
Right.
Allergan obviously had a really good marketing campaign when they came out with Botox, so that's kind of what everyone knows it as. They're all have just little tweaks of the strain.
Yeah, they all have their own neurotoxin. Each company has their neurotoxin, and
So it's really just different formulations that
Do the
they all
same
work.
thing.
They all work.
Yeah.
They all work.
some people are diehard one versus the other. I've had all in my face. I think I've injected all.
And I think it's just
So
one of
it
those
just
things
depends.
where patients go, well, it didn't work for me, this one didn't work for me. I think it's maybe sometimes injector dependent, where it got maybe diluted a little different, not
Gotcha.
enough. So it works, it's just maybe you didn't have enough, or dilution was different.
And you guys use all of them here.
Yes.
Yes. Okay. So another question that we have is, how much do you normally charge for both of those things, fillers and Botox?
So neurotoxins are kind of hard to explain.
Or
It
where
just-
do they start? Maybe like a range.
Well, we start, so like for like the little angry lines in between your brows, everyone doesn't like that. It's a great area to start, because if you have never done a neurotoxin, a toxin, it's a great area. Around 200 to 250
Yeah,
is typically
it's easier
what it
to
costs.
explain kind of per area. So 2
Yeah.
to 250. Forehead,
Adding
depending on how
forehead
much you
on.
pull, 10 to 15 units to help with that.
So,
Around the eyes, like the crow's feet, I'd say again another 10 to 15, 100 to 150.
it just kind of depends. I mean, it really depends on how strong their muscles are. Men have stronger muscles than females. It takes a
Yeah,
little bit
men
more.
use a lot more product.
Some women have really strong muscles, so it takes a little bit more. But
Yeah.
typically 200 to 250 around the glabellar, and then on top of
And
that,
if you notice, like some people really pull with their eyebrows, but then when they lift their eyebrows up, they don't necessarily have a lot of lines, or it's the opposite. They lift and they're like lines for
Lots of
days,
lines.
or and then they frown and there's hardly anything that you can see. So
Yeah.
it goes off the injector, but it's on average 200, 250, 100, 150, 100, 150.
So people spend if they did their forehead and maybe their crow's feet.
you're probably looking around 450.
Gotcha.
For full treatment.
Yeah.
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 And depending on the age,
Yeah.
you know,
Yeah.
when you're doing preventative work, that does make a difference.
Or how much movement you want. If you like to be completely kind of frozen and not be able to move,
Right.
or if you like to have a little bit of movement.
Yeah.
Gotcha.
Filler
Yeah. What
prices?
about yeah?
So fillers, all of our fillers are normally $600 a syringe. Obviously, like the Bubbles and Botox party, we're gonna have discounts there.
Right.
We don't discount them super often, so it's kind of rare.
Yeah.
The reason why we do them across the board, even though they cost us different amounts, is because then we can kind of
Pick and choose what we want.
what we feel like is best for you, not what's cheapest.
Yeah. Which is awesome.
It's
Yeah.
nice.
Awesome
and
for us.
Yeah, exactly.
Yep.
So it's nice.
Well, and you usually have happier clients that way.
Yeah.
Yep.
Totally. So when you do this, is it immediate? Obviously, fillers and Botox. You'll have to tell us the difference.
Botox is not immediate. I always say 7 to 10 days for Botox to kick in, or the neurotoxins to kick in. Sometimes it's faster for some individuals, but I say 7 to 10 days.
Yeah. On
Um,
average, manufacturer says wait 2 weeks. Same thing with filler.
Yeah.
So filler is immediate.
Yeah.
Filler, you can definitely see it's like that instant gratification. You can see the difference. I almost tell people to hold on to that difference, because when the swelling starts setting in certain areas, you're kind of like, oh, is that what it's going to look like? And that's kind of where the anxiety comes
Yeah.
from.
Yeah.
And it's like, no, look at it immediately after, and that's probably what you're going to get.
And I think sometimes volume looks good on some people because
Yeah.
they're volume depleted. And so sometimes when that swelling goes down, they're like, where did my filler go? Well, that just means you need more filler. So that's why we try to start earlier than later, because
Yeah.
it takes less filler.
Yeah, but filler is immediate, which is nice.
Yeah.
You can kind of see instantaneous results. But it's still, I tell people give you like a 3-day freak out phase of like swelling and whatever it's going to do, and then full 2 weeks before we tweak
Yeah.
anything.
Gotcha. Where can you put filler? Because you can put it
You can
quite a
put
lot of
filler,
places.
Really, and it's kind of nice. We use it a lot off-label,
Yeah.
and we dilute it down sometimes for different consistencies,
So,
like neck,
yeah.
crepiness in neck.
Because a lot of them, like I
Chest.
said before, are biostimulators, so they stimulate your collagen production. So now, especially, we can dilute it down just to get that stimulation of collagen and kind of
And it's true. Gone are the days of just nasolabial folds,
Yeah.
the smile lines.
No, you can
Now
put
we're talking about jaw
So you can
lines,
do cheeks,
and cheeks,
jawlines,
temples.
you can do temples, you can do a little eyebrow lift, acne scarring.
There's everything.
Technically, you can put it in bums. You can put
Yep.
it in legs for cellulite. They're saying now the collagen stimulation is really good for stretch marks.
Yep.
For
interesting.
mamas.
You can put it anywhere.
We've seen like before and afters of like legs, kind of
Crepiness,
cellulite legs, crepiness.
arms,
Yeah, the wings, back of the hands. Cool.
Yeah.
You can put it everywhere.
anywhere.
I love that.
Yeah.
That's the best.
And a lot of people don't know that. A lot of people are
Yeah, I
like,
just
hey,
think
you
it's
do
just
lips,
this.
and that's it. Like,
Yeah.
or the laugh lines. Like they're starting to know that now.
Yeah.
But no, you can. There's a whole world of what you can
Where
do.
you can
Yeah.
put it.
Mhm.
Well, thank you guys. This is Amy, and I should have said this is Cassie from the Idaho Skin Institute. And if you have any more questions,
Yeah, feel free.
obviously,
Yeah, we'll be
call your
there that
office
night for
or
Bubbles
yeah.
and Botox.
Bubbles and Botox.
We'll be around for questions. We have our whole
And
nursing
there's some
staff.
awesome
and
deals that day.
Yep.
It'll
Thank
be
you
fun.
guys.
You're welcome.
Thanks, guys, for having us. Bye.